Hello and welcome. Today, we're diving into a fascinating topic: the differences in working with male and female clients from a psychological perspective. We'll explore whether there are significant distinctions in how psychologists work with men versus women, and how the gender of both the client and the psychologist might influence the therapy process. We'll look at brain differences, the impact of gender on therapeutic relationships, and how these factors affect client expectations and interactions. Let's get started.
Do we have two types of brains?
So, is there such a thing as a male brain versus a female brain? While no evidence suggests that intellectual abilities are solely determined by brain structure, men's and women's brains do develop and function differently. Research from recent decades indicates that there are indeed some general differences between male and female brains. So, for instance, the limbic system, which regulates emotional and instinctual behavior, is more dominant in women, while men's brains have a larger neocortex, which is responsible for conscious thought, analysis, and decision-making. Men typically have around 11 billion nerve cells in this area, compared to about 9 billion in women. Conversely, women often have a better developed frontal lobe, which is involved in planning and decision-making. Interestingly, in stressful situations, men's right amygdala becomes more active, while women's left amygdala is activated. This explains why men might focus on the big picture and women on details. However, these differences can vary, and about 10% of women and 15–20% of men might exhibit more characteristics typically associated with the opposite gender's brain structure.
Choosing the right gender for your therapist.
You might wonder if it matters if your therapist is male or female. Some theories suggest that therapy might be more effective if the therapist is of the opposite gender. For instance, psychoanalysis posits that a woman might benefit from working with a male therapist to address issues related to her father, while a man might benefit from a female therapist to work through issues related to his mother. James Coles discusses this in his book, Under Saturn's Shadow: Male Psychological Trauma and Its Healing. Ultimately, one of the key goals of therapy is to help clients address and heal emotional wounds from childhood, often by creating an idealized parental figure in the therapist. This process can help clients work through their unmet needs and developmental challenges.
Handling romantic attraction in therapy.
Another complex issue is the potential for romantic attraction between clients and therapists. If a client develops feelings for their therapist, it's crucial to address this professionally. The therapist should set clear boundaries and focus on the therapeutic goals. If a client expresses romantic interest, the therapist should recognize and address this behavior appropriately and refocus the session on the client's needs rather than personal feelings. In situations where attraction leads to manipulation or demands, therapists must maintain professionalism and guide clients towards healthier coping strategies.
Gender differences in psychological approaches.
So, how do male and female psychologists differ in their approaches? Despite individual styles, there are some general trends. Female psychologists often emphasize empathy and emotional connection, while male psychologists may focus more on logic and factual analysis. Women typically prefer a compassionate and responsive style, whereas men might value a more straightforward, goal-oriented approach. Women clients often deal with issues such as personal disorders, depression, anxiety, and relationship problems. Female psychologists are encouraged to support emotional well-being while avoiding feminist or patriarchal biases. Men clients, on the other hand, might struggle with issues like life dissatisfaction, social challenges, and difficulty with self-disclosure. Male psychologists often use a cognitive approach with less emotional immersion and are usually consulted during crises.
Embracing gender diversity in therapy.
It's important to remember that while gender can influence therapy dynamics, the ultimate goal is to provide effective support and understanding regardless of these differences. Both male and female psychologists bring valuable perspectives and skills to the field, enriching the therapeutic process and helping clients from diverse backgrounds. Thanks for joining me today. Don't forget to like, subscribe, and hit the notification bell to stay updated on our latest content. See you next time.